listening to Tapped In, Buncombe County's half hour to empower on WRES 100.7 FM in Asheville. Listen up and get tapped into local important resources, information, and topics. Learn more about the topics of today's show at buncombecounty.org. Okay, it's time to get tapped in.
Hello, hello, hello. And if you hear my voice, you know it is time to get tapped in. I'm Zakia Bell Rogers.
And I'm Leonard Jones.
And Leonard, who is with us today?
Today we have Kerri and Molly from Buncombe County Mobile Health Team. So they're going to be here to share about their program, what resources they bring out to the community, and who they're trying to serve. So welcome, Kerri and Molly.
Thank you. Happy to be here.
And I got so excited, I forgot to tell the people where we're from. Leonard and I are from Buncombe County government, and we're in the communications and public engagement. Well, real heroes wear capes. I am so excited about you all being here. I missed that whole part. You are with the mobile health team, and tell us what the mobile health team is.
Yeah, so we are the Buncombe County Public Health Mobile Team. We're really an extension of the Buncombe County Health Department. So we go out into the community, we have an RV, we have a mobile van, and we go and set up across the county at different event sites, different housing areas, all sorts of different places where our services can be used. And we really just want to partner with the community to create increase access to everybody in the community, and especially reach those who are low income or uninsured or who otherwise have a hard time getting to the health department and getting the services that they need.
Oh, okay. So you said we have an RV and a mobile van. Mobile van.
Yes.
You can't say that real fast. So tell the folks what the difference is between those two. Yeah.
Sure, yeah. And so, it feels weird. So just to back up a little bit, so the RV came more recently. So they had been going out with the van and doing vaccines primarily, and also harm reduction. And then with the addition of the RV, we could start doing more STI testing. So we can do rapid testing for things like HIV, hepatitis C, and syphilis. And then also some other STI testing, since we have that private space with the RV. So we can take that. And then we also have a peer support on our team who does harm reduction, which is
And what is harm reduction?
So harm reduction is working with people who are using substances and helping kind of meet them where they're at, right? So like maybe they're not going to quit using their substance of choice, but it's about getting them access to clean needles maybe, or other equipment to make sure that they can stay safe. Maybe they do want to get into some sort of program, or maybe they want to get into like a MAT program, so medication assisted treatment. It's kind of just meeting them where they're at to see like what their goals are, and then we work with the community paramedics, and they can kind of help facilitate that as well.
Yeah, so currently what that looks like on our team is our peer support specialist who has experience in this area and is able to talk with people, provide them with support, get them connected, and then work with different organizations in the community where they can access some of those other resources such as clean needles. That's what I'd say about the harm reduction piece, and that's continuing to grow as well.
That is awesome. And I wanted to go back because I know you said STI, and I know growing up in my day we said STD, and so STI is sexually transmitted infections.
Yes.
Okay, so I just want you guys out there to know what those acronyms are for and everything. So thank you so much for that.
Yeah, so you mentioned, again, you said the RV just came online in the van. So how would people recognize that y'all are out at a place, or what's the logo, or how would I know if y'all present somewhere?
Great question. So if you're just driving by, the RV is pretty big. It does say like Buncombe County Mobile Team or Public Health or something like that. So you should be able to see that. And then the van is a little bit smaller, but it also is wrapped. So if we're just out and about and you see that, anybody can come up and see our services. But we do also have a calendar on the website. So with buncombecounty.org RV.com/mobile team, and that will take you to our website with all of the locations where we're going throughout the week. And I'll just add on a little bit about the RV piece and the van. So we really just kind of use whatever works for the location that we're going to. So for example, if we're set up at a site that doesn't have a lot of like parking area, we may just bring our little van because it fits in a normal parking spot, and then set up inside of a community room or set up on the sidewalk. Ideally we have the RV because it just provides more confidential space, but that's not always possible. So we really just kind of make it work for whatever location that we're going to.
So when we talk about like a mobile health or going up to your van or your RV, and you had kind of alluded to it around the confidentiality piece. So if I'm a listener out there and I'm just wondering about privacy, how do y'all handle that?
That's a good question. Yeah, so it's very important to us. Like I think Kerri said, we're an extension of the clinic, so we definitely, respect people's confidentiality and HIPAA, and there are like vaccines are generally not as private, right? Like we'll often do vaccines in a more public space, but take people kind of one-on-one and do their questions and their vaccine. But if it's STI testing or other more maybe personal questions, we'll take them just one at a time onto the RV. So it's kind of like an exam room,
Okay.
Yeah.
And does it look like an exam room on the inside? Like what?
Kind of. It has like a seating area for the patient as well as a bathroom they can use and a sink and clean space. So yeah, it definitely is kind of a
because when you think of an RV, you always think of those fancy, smashy ones, as you say. Yeah,
it's not fancy.
How big is it? Like, what's the footage on it?
I think it's 25 feet long,
Wow.
and maybe like 15 feet tall, something like that. Enough to like hit some branches every now and then.
So wait a minute, are you all driving it?
Sue and two of our team members are. Sue and Jessica drive it. I have not driven it.
Yeah.
I don't want to.
Are you like licensed to drive? Like, do you have to have a special license?
Not for this one.
Okay.
We're just under the like requirements. I don't know what the official.
the
CDL. So the size we got, you don't need a special license.
Okay.
But you should practice. But you don't need a special license, which is why one of the reasons that they chose this size.
Yeah. Well, that's cool because my brain just went. I was like, oh my god, if it's that big, because I'm thinking like, wow, not only are they healthcare specialists, they have CDL. That's what I was thinking. So I'm sorry that went down that whole rabbit hole.
It's a good question.
Because I was just like, God, you all are really amazing, and you really are.
We just don't have our CDLs.
Okay,
I think just might, but
yeah. The RV's been a journey, and it's been really helpful. But like Kerri was saying, like our main goal is to just get in where we need to be, right? Like where people have a lot of barriers to getting into care. So if the RV doesn't fit where we're going or it doesn't make sense, then we'll make it work, right? Like we're trying to find people where they are. So
So I heard you say you have a calendar on BuncombeCounty.org's page if you want to know where y'all are already pre-scheduled to attend. What if there's groups of listeners that's having an event? Can they contact to kind of request the mobile health unit to come out there? And if so, how do they go about doing that?
Yeah, absolutely. So if you go to that website, BuncombeCounty.org/mobile team, there is a link there that says like request our services. So you can just go to that, and then it asks about what kind of event, who are you, what are you thinking of wanting to do, and if someone's interested, they can fill out whatever information that they have available. So it's okay if you don't have all the details figured out and it's like something you're like, oh, we want to do this thing in 6 months, or if there's a specific event, then you can provide all that information, and then one of us will follow up to get more details and see if we would be a good fit for that.
Do y'all got a phone number or anything?
We do. Not sure what it is though.
I don't have my card with me. I don't know the main number. Oh, you know what? Here it is. This should be it. The 828-250-5716.
Okay.
Say that number again.
828-250-5716.
Okay, so they can go to BuncombeCounty.org or call that number that we just talked about.
Yeah, and we're specifically wanting to focus on, really like we said, like people who are low income, uninsured, have transportation barriers, just or getting out to places that are further out in the county. That's another reason that we exist. So there's a lot of services and resources here in the city of Asheville, but we also like to get further south and go up north and east and west and really get out to some of the more rural areas to make sure that people who aren't coming into the city as much are also able to access our services.
And I always wonder, like, you know, your sandy marshes and your big ivy areas.
Yes.
I'm just not sure about the preschool, or what is it, more at 4 programs. I know that opportunity was it action? Community action. It used to be community opportunities when I was a kid, but they have programs where they go out to all these different areas and they pick up these kids and they bring them to daycare and everything. So are you seeing like folks like that who they have this service, but they may be in the middle, or they may not have a like real primary care doctor? It may just be like a health clinic in their area. So would that be a good candidate to come in and get or meet you all to get vaccinations and things of that nature?
So yeah, this is a good point or time to point out that we do not provide primary care. Just for anyone listening that we didn't make that super clear. So yeah, we provide immunizations, STI testing, but we don't offer primary care. So yeah, if somebody does not have a place that they are already going to, a primary care provider, we are happy to see them. We also might try to link them up with somebody because that is important. So I guess another service that we do offer is really like providing connections to other resources in the community. We work with a lot of different organizations and people and just community health workers, all sorts of different groups that we can connect people to if they do need services that we do not offer. But yeah, so definitely if someone does not have a primary care provider, we would love to see them and at least get them what we offer, get them what we can, and then hopefully get them plugged into some more things as well.
And what are some of the biggest shots that you see that adults forget to get or are missing?
I would say, especially after the hurricane, we were giving a lot of tetanus shots. I think sometimes people forget that that's every 10 years. And then also hepatitis A and hepatitis B. You know, that's, I think in like the 1990s, they started doing that routinely in babies. So there's a lot of folks that they did not get that. So yeah, that's one that we give often. And of course, flu and COVID have been a beast this year. I think it's like one of the worst flu seasons, you know, in 20 years or something. So that one's one we're really pushing for sure.
My daughter had her flu shot and she got the flu and COVID.
Yeah.
And it was extremely rough. So my thing is, if you can get those shots, please get them because it is absolutely painful.
Yeah.
So, and it's real. It is a real thing. And so tetanus. We all hear about, because I want to make this clear, people always say, well, what is tetanus? You know, like if you get cuts, touch rusty things, what else is a reason to get a tetanus shot?
So yeah, tetanus lives in the soil actually. And so, getting cuts where dirt could have got in. That's why we were really trying to push that after Helene is like everybody was in the mud. Everybody was like getting cuts from all sorts of different sources. So if you get especially like a dirty wound, like, and it's been more than 5 years, we actually recommend an update of the tetanus vaccine if you get like a really dirty wound where there's like dirt that got in there, or animal bites is another one if it's been over 5 years.
Oh, wow.
So that's when it's recommended. If you have anything else to add to that. I would also say with the tetanus vaccine, the one that we offer on the mobile team is what's called Tdap. So it's tetanus, diphtheria, and pertussis. And pertussis is whooping cough. So
and that one makes your arm sore.
It usually does, yeah. But it's worth it.
Hey, we're trying to sell this.
You'll be fine afterwards. But yeah, that one. So we offer that. There is another version that's just tetanus and diphtheria. We typically don't have that on our mobile unit, but if someone needs that because they can't get the pertussis piece for whatever reason, they can come into the
you should get them
clinic.
all.
Ideally,
yes.
Yeah,
I'm sorry. You did not hear me say that.
No, it does make your arm
it's
hurt.
okay.
But yeah, I mean, it's one of those things like,
in a good way.
A little bit of, in a good way. It's so good.
It's right.
And I did want to back up up and say, just to kind of reassure everyone, part of our goal is to meet people who are maybe don't trust the medical system. There's a lot of people who do, for good reason, don't have trust or are nervous to come into government buildings. So when we go out into the community, wherever we are, we do have people fill out a basic form, but we're not going to ask, for ID. We're not going to ask for any, Social Security. Like there's no, like we're a safe place to come. That's kind of one of our main goals is to let people know that we're safe and for anyone.
And what about the cost and structure? Is there any cost or anything?
So we do accept insurance if you have it, but if you don't, then our services are free, like the vaccines and the STI testing. So
Oh, wow.
Yeah, we don't charge anything for anybody.
So I have a question. You have somebody that's born and raised in North Carolina, never left, been here all their life. They go in, you pull their vaccination record, and they have nothing on there. And they are like, I've had them. What would you do in that situation?
So it's a conversation. If someone, ideally, someone who was born and raised in North Carolina, we pull up what's called the North Carolina Immunization Registry, NCIR, and best case scenario, we see every vaccine they've ever had. And we can tell exactly like which ones they need or don't need. But a lot of people who potentially were born and raised here, or who were not born and raised here and just moved from somewhere else, we'll try and talk with them about what they remember getting. Ideally, if they have access to the records, then we'll ask them to send it to us, depending on kind of what's going on or how old they are or what they're at risk for. We may recommend them going into the immunization clinic for some other vaccines that we don't offer, if they're not totally caught up, or if they're not sure that they are caught up. Some of the childhood vaccines would be important to get, things like MMR, that we don't, at least at this point, carry on the mobile unit. So, but like, for example, if someone came in, they had no record, they have no memory of their last tetanus vaccine, then we would recommend getting that to them.
We just take people at their word, and there's no harm. Like, let's say you did get a tetanus vaccine 5 years ago and you forgot, it's not going to harm you get another one today, so.
Yeah, I remember the last time I got a tetanus shot.
Really hurt.
Because your arm hurts?
No, it's not that. It's been almost 10 years. So I'm saying, but I have a doctor's appointment next week. Don't judge me. So I'm going to ask my doctor to get. Don't try to take me to your van. You should have saw them.
Some shots with us.
You should have saw their little eyes. They were so excited. They were just like victim. Yeah, but no. So I am, because it is very. I thought, and this is going to sound so insane, that tetanus was only if you stepped on a rusty nail.
Yeah.
And because that's all they told us as kids, and you get lockjaw. And for me, I just thought I couldn't talk. And that would be death to me. I mean, that would be. But then, like, I did like some reading. Like, it's fatal for some people. And so my thing is, folks, if you get nothing else, please get those types of vaccines, because we need you here and we want you here. And we're almost out of time, but I would like each one of you all to give our community something to take hold of. And so go ahead. I'm gonna start with you, Kerri.
So I would just say, if you see us out in the community, please stop by. We love just connecting with our community members, and we want to continue to expand who we work with and who we're reaching. And we know we're not reaching everybody that we want to yet. And so please reach out to us, and we're kind, and we're hopefully helpful, and we really want to support you where you're at. We're never going to push anything on you, so we're really safe. And if you feel uncomfortable going into a building, into any kind of medical structure, we're happy to talk with you outside on the street and just answer your questions and do whatever we can to support you where you're at.
Yeah, I mean, ditto to that. And also, I just want to say, just reiterate that we're a totally non-judgmental team, and we really are trying to meet people where they're at. And there's a lot of, vaccines are obviously hugely important, but there's also a lot of STIs right now that we're trying to take the stigma away from. And we really just, if you can get tested and get treated, it could save your life. And so we feel very passionately about getting people tested. And there's, again, no judgment. It's just something to take care of your body, take care of your health. So we just want to kind of eliminate that barrier. And then ultimately, we're going to work with the clinic, if someone needs treatment, but we're going to make a plan with someone,
Yes.
So I think a lot of people are scared of what they might find out, but we're going to help people make a plan to, take care of their health.
Yes.
Yeah.
Leonard?
Well, I would just like to say it's great to have y'all on today's show. It's great to see that, when we talk about expressing equity out there, having a mobile RV and van that's going out, giving out immunizations and testing you for STIs and also making referrals. That is how the county is being equitable. We are actually trying to meet people where they are, share the information. So if you want to know more information around the mobile health unit, where they may be or how they can come to your next event, we again let you know that there is a calendar out there on buncombecounty.org/mobile team. And again, if you just want to call to have more of that one-on-one conversation on how they can come out and support. Their number again is 828-250-5716. So yes, go to buncombecounty.org mobile team to find out more information about today's episode.
Yes, and I just want to say to all of you wonderful, wonderful folks in Buncombe County and everywhere around, there are no stupid questions when it comes to your health. If you want to know something, and you don't have to go in and you don't have to take anything, again, we are meeting you where you are. And if you just need information, I call it GIA. First you gather up the strength to go, and then you educate yourself, and then you take action. And sometimes that's the steps we need to do. And if that's what you need to do, you go right ahead, because we're going to be there to help you. And just understand, asking questions is the best way to find out the truth to something. We know there's a lot of information out there that may not support different things, but we want you to make sure that you are getting the correct information and you are able to have people that you trust to talk to. So please get in contact with our community health providers. And at the end of the day, we want our people in our community to be safe. We want you all to be healthy. We want you all to be strong. We have been through so much in this last 5 months, and we are recovering, but our recovery is a long, long way. There's still a lot of work to get done, not only with ourselves, in our community, but outside. And if you're going to be outside doing all that work, we need you to be safe there too. We are one Buncombe. And until next time, you've been tapped in.
All right. Oh, okay. This thing is struggling. Okay, whoops.
Thank you for listening to Tapped In, Buncombe County's half hour to empower, here on WRES 100.7 FM in Nashville. Learn more about today's topics at buncombecounty.org. Otherwise, stay tuned for more great episodes coming up.